was looking for somebody to set some mirror direction.
Terry.
You practice at the Hammond campus?
Dr. O's.
Conversation. Sorry, I apologize. We have name tags?
We do. Play musical chairs on you.
On your seat.
Yeah.
Don't leave me empty over here.
Can't hang out with you guys. Sorry.
Sorry.
You know what? I'll give him my agenda if you'll share yours.
Patrick's gonna be.
Oh, we're live, huh?
Right. We are at 5:30. If we can all please stand for the pledge.
30?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Thank you all for joining us. Dr. Fleming will be joining us just a little bit late. And we have Terry, who's not here today. If everyone had a chance to review the minutes, and if I can entertain a motion to approve if there's no questions or concerns regarding that.
Motion to approve?
Great. Second?
Okay, Dr. Bonson,
Yes.
Dr. Brunt,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Rosan,
Yes.
thank you.
Thank you. So with that, our next meeting is scheduled for January 9th, which is the second Tuesday of the month. And then going forward, we'll try to remain on the first Tuesday of the month for the next calendar year as much as possible. And then we're going to move on to new business.
All right, wonderful. We would actually like to have Jan Pierce come forward to do our public health needs assessment report, if that will be interesting.
Very good.
Quick
We're-
flip up there, new business section.
See if I can face everyone. I'm Jan Pierce. I'm the principal of Pierce Healthcare Group. We're a healthcare consulting organization and have been working with the Public Health Department on a needs assessment. We began the process in August and are going to present the PowerPoint with highlights of the report. The full report has also been presented, which is has greater detail, but I'm going to go through the highlights, the key findings, and the recommendations from the report. So just a quick overview here. As I mentioned, we started in August completing this, and I'm going to go through this executive summary here today. This is a team that worked in here myself. My background is in social work and business, and Ann Schreiner, who was CEO of a certified community mental health center. We were involved in conducting interviews throughout the county as part of the report. So the objectives, were first and foremost to conduct a community health needs assessment, focusing on key areas health in the framework of the Indiana Public Health Services and in collaboration with the Health Department board and team. We began this process with a board and staff retreat that helped us launch the process. So we were very interested in a participatory process for this project. Our focus, the second objective, was really identifying unmet needs, gaps, and priorities, hearing from key stakeholders, and then, of course, putting this all into a report. And as I mentioned, there's a full report, and we'll go through the highlights today. So in terms of the interviews, we conducted a total of 35 interviews with various stakeholders throughout the county, with a total of 77 people involved in those interviews. In addition to that, we were involved in the resource networking group and had other participants in that group. And as you can see, the segments included agencies, law enforcement, the recovery community, schools, a broad range of different stakeholder groups that we met with. So to begin, we took a look at the literature as to public health today to really have a framework for conducting the assessment. So the first, I'm going to go through a couple of the models that are out there. The University of Wisconsin Public Health Institute does county health rankings, and we'll look at Porter County and where Porter County is on some of those rankings. But this is the model that they use just to give you that framework as you think about the rankings. So in the blue boxes there, they're blending factors of physical environment, social economic, clinical care, and health behaviors, and there's kind of different percentages in each of those as they look at how to drive policy procedures to impact health factors to have positive health outcomes. And again, they do a county-wide report. One report is published by the state of Indiana, taking all the Indiana counties and ranking them, and then the Institute presents their own reports as well. This is from HHS, the Office of Disease Prevention and Promotion. Again, major focus in public health on social determinants of health, and was certainly a discussion in our meetings, particularly with the individuals from the healthcare arena, with the FQHCs who are very interested in having discussions about social determinants of health. This is from the National Institute of Health as their focus and definition of the 10 essential functions of public health. This is from a paper published in December 22. And there was an additional article, it was kind of interesting, from the Journal of Public Health. They had 3 Ps for public health promotion, prevention, and protection, and their focus was going forward that there needed to be 3 more Ps, prediction, precision, and participation. And certainly I thought that was thoughtful in that a big theme that we heard in the interviews that we conducted was the importance of participation of the health department with individuals in the county, in collaboration and participation across agencies. And it's certainly, I think, in line with the feedback that we got from the interviews. So I'll go through the kind of key findings. The first was taking a look at where are the areas for service development, identification of areas that were focused on as having unmet need. So 3 major areas that we heard in basic needs were housing, transportation, and food security. On housing, there were discussions of a couple different aspects of housing. One, being the homeless population and concerns about that population. Also concern raised about the affordability housing and housing prices, and whether that was going to be creating barriers for individuals living in the county in the future. So there were a range of comments about challenges of housing in the county. On transportation, identified that Valpo does have some public transportation, but significant concerns about transportation being a barrier to individuals being able to access health care, being able to get to health care appointments. There's a few services. 320 Recovery, for instance, has an agreement with Lyft where they're able to provide some transportation, but not in any broad organized way. So there was much concern that transportation is a barrier of people getting to healthcare appointments, the lack of public transportation or other transportation systems. In fact, I talked to the Council on Aging, who does have a bus service, and they shared that they have half as many buses available for transportation than they had 10 years ago. So that there, it really is a concern about transportation. I guess they're having some discussion about adding buses, and but very concerned. And of course, this is at the same time we have the aging of the baby boomers and less bus availability. So transportation, a concern, and then food security. In fact, one of the schools that had a pantry at the school, so they used to have a line that was a couple people outside the door, and recently there was a line out for a block long outside the school to be able to access food. So those 3 basic needs. Safety, this we really heard from the Department of Children's Services and from the schools about gun safety with children and incidents that have occurred in the county because of safety and some significant concern about gun safety with children. The third area we heard about was insect parasite infestation, and again, this is with children from the schools and coming Monday morning after a weekend and several outbreaks in a number of schools, and also heard about that from the Department of Children and Family Service, and that there's been some small kind of intermediate initiatives, but I think the hope there was that there could be better research and a broader plan on what could be done more proactively in that area. Also some mentioning of some environmental issues with flooding. In healthcare needs, far and away the biggest concern raised were mental health services. Significantly from the schools and agencies, but across the child, adolescent, and adult population. But we heard these concerns from pediatricians, from schools, from agencies, from township trustees that we met with, so across a number of different stakeholder groups. And the concern there is that there are services. Their concern is that there's often long waiting lists. Someone from the Y said what happens is they have untrained workers who try to provide support, for the 3 months that someone's on the waiting list, who's really doing absolutely from the heart and the best that they can do, but not a trained professional to work with that individual with the mental health issue while they're on a waiting list to be able to access care. On maternal and child health, actually, you'll see in the scorecards, the ranking is good. It's, I think in top 5%. The concern there that was raised was probably more in the child care, affordable child care, and access to affordable child care. And then through this all, and this was particularly from folks in the health system, hoping to have continued conversations broadly across the county about social determinants of health. So that's the first finding. Second, the health department. A lot of respect by Porter County stakeholders for the health department. Of particular note was mentioned leadership during the COVID pandemic, as well as a number of people noted the mobile health van as particular strengths. The suggestion was that they would like to see the health department have more visibility and more engagement. And the word engagement became a key part of this. The suggestion was rather than kind of more one-way communication or education, how can the health department do more interactive engagement of individuals? And that was a major theme. And again, the framework was that it's working not only with the community, but also with partner organizations. So I think there's a number of other organizations in the county that want to be part of the process, and we're very clear that this isn't solely the responsibility of the health department. The key is, can the health department provide leadership for the strategic partnerships and coming together of some of these other organizations? Leading us to strategic partnerships, and this was kind of the verbiage, and the first one is really from one of the participants who said that the public health needs are beyond the scope and capacity of any individual organization, including the health department, and that it was essential to develop strategic partnerships for monitoring the trends, for identifying the gaps, and continuing to develop and offer needed services. And I think everybody sees this as a dynamic process. It's not, we do an assessment and we have a roadmap. There needs to be continued monitoring of trends because obviously it's a dynamic process in terms of healthcare. And again, the hope that the public health department could be in a leadership role of this process of strategic partnerships going forward. Emergency services, concern about access for services in urgent situations, and you'll see that in the in one of the dashboards on the use of hospital services being at a much higher level. A higher level compared to other counties, and again, kind of where are we at in terms of access? Okay. And then 5, we for the findings. So the interviews were qualitative feedback. Then quantitatively, we looked at these 2 county scorecards. One published by the state of Indiana and one published through the University of Wisconsin. I'll take a look. Thank you. Hi. Good. Good to get friends. So as you can see here, there's how we were ranked in the county. So of positive note in infant mortality, ranked at 3.70 compared to an Indiana rate of 6.8. The 2 lower rankings are in 50th suicide and the adult obesity at 47. If, in terms of pulling out where the rankings are certainly to be considered. Now, I do want to say I know there's been a number of initiatives in the county about suicide, so I think this is, again, where the importance of having metrics and data tracking, because these are 2022. So I think it's really important, though, when we get these priority areas, that we really need quarterly data to be able to track this, because we want to be sure it's as current as possible to take a look at these areas. But I think the scorecards help us prioritize and focus on areas and have a tracking mechanism so that we can see how we're doing. The other findings, and this was kind of nice how the university responded, they give positive feedback to counties and then they give areas for improvement. So in the University of Wisconsin, these were some of the favorable Porter County rankings. But their areas for focus, again, adult obesity 1, adult smoking, and this was what I had mentioned earlier. They have a way, and when I looked at the data, they're using Medicare data, so I'm not sure if that's exclusively then the Medicare population. But the preventable hospital stays, the number here was much higher than where the rankings were. So they, again, which is, what are the options other than a hospital stay for somebody needing services? And we certainly heard that with adolescents needing inpatient psychiatric care, descriptions of, 3 days in an emergency room and going home because there's not bed availability. So, again, the hospitals, including emergency rooms, being a place for urgent care situations and not being the best place for those kinds of situations. So recommendations, I think there's an enormous amount of data here, qualitative and quantitative, and of course, the health department has the opportunity with Health First Indiana to relook, to vision, to reimagine, if you will. So I think that's a great opportunity to take these, each interview we did, there's a summary of that interview. So there's a lot of information from a wide range of people, as well as the scorecards and the snapshots from the scorecard, to take that into a strategic plan to be able to set measurable goals, objectives, and evaluation metric with an implementation plan and a review process. And I think it's a great, you have great information and data to be able to use from a planning perspective. Second, the understanding the framework, I gave you some of what's going on in some of the public health literature, about increasing the focus on participation and engagement. And I think it's, again, a great opportunity to really think through what's the vision and what's the framework for public health here in Porter County. From a needs area, clear recommendations for basic needs of housing, food security. And with the food security, a number of mentions of both food security and nutrition, to be sure that, there was some discussion about, well, it could be a package of something, but not that's given, that's food, and it's certainly meeting an immediate need, but not nutrition, and discussion of cooking classes and all sorts of ways to include that food security with improved nutrition. And then again, the public transportation, really being identified as a barrier to access to healthcare and other services, including with the senior population, as we heard from the Council on Aging. For the partnerships, again, lots of interest in collaboration from agencies, from the schools, and really the hope that the Public Health Department can play a leadership role in bringing organizations together. 5, and I mentioned this earlier, really the most often mentioned need was mental health services, from a whole wide variety, whether, again, it could be clergy or agency, and, it wasn't this from the healthcare, the schools. I mean, one after another, the school, and they have services being offered in the school. I mean, Porter Stark is in every school. I mean, there's more and more services. And even with all of that service, it's the top of everybody's list as a concern. Just one last thing on the way. And with that, still discussion about how do we address stigma. And, I think both with children and very much discussion about stigma being a barrier for individuals receiving services. So again, recommendations, as I discussed, the health department develop a leadership role in public health and include, again, more than communication, engagement, and that's the word. The mobile vans got attention, but we were at the trustee meeting, one trustee saying maybe they're going to have to just go into the home instead of just in the van. So, and again, I think it's, are we really brainstorming how do we get engagement to the level that's needed? Some of the second tier, those were the top tier issues. The second tier issues, the maternal health, primarily child health care. I mentioned the insect parasite infestation, which seemed to be kind of geographically focused in certain areas in the county, and flooding issues. And these are probably ones that need further information and evaluation beyond the interviews that we did, but I, offer them to you. And then finally, and this was suggested by a couple individuals, that is there a way to get a county health dashboard of metrics that could be shared? And the discussion was that be a way for the strategic partners to also see, who's working on which of these metrics and how can we come together and we have a way of measuring and being able to share those metrics to see jointly and collegially how we're moving forward towards goals. Okay. So, thank you. Thank you for the water.
Do you mind taking a question? So the food insecurity topic, was that at all addressed, like in the schools with the school? Well, where did that arise for you more? I know we'll get more detail with her.
Well, it was mentioned in one of the schools where they, used to have 2 people outside the door, and now they have a line a block long outside the school. Now there, I think the school is a location where food is being distributed. And so it was mentioned as a community concern, although not specific to the student population. The families of the students was the school's concern. Mm-hmm.
Does anyone have any other questions for Jan?
Are we going to get the full
report?
Okay.
Well, and I mentioned to Carrie, this is the highlights. It's a 44-page report. So because we have bullets and highlights from each individual interview. So absolutely, I'm available for a follow-up as sometimes it takes a couple weeks to digest all of this and to think it's digest and then application. And, absolutely available to have future conversations and whether it's a clarification or, further discussion about implications of a particular initiative or a particular recommendation. So there's a lot of detail there. I mean, this is to give you a highlight. I want to be sure today you have a framework
Yeah.
and an overview to be able to read the report to see how we've rolled it up. But absolutely encourage you, independently to take a reading and to study and see where you land in terms of the summary of findings and recommendations.
My plan was to send it to the board members and all the supervisors tomorrow. And then we also will publish it on our Health First Indiana link on our website. I don't know how immediately that will be able to go up, but definitely we'll get the email out and we'll get that ticket in, so.
Very good. Jan, I want to thank you so much for all the work you've done in this study and for your report today. I'm looking forward to kind of diving into it a little bit deeper and using it to help guide our priorities and our plan going forward. It really, I think, gives us a lot of food for thought, things that we can, I think a lot of us probably have things kind of ticking in their head, things that we can work on pretty much right away, things that may be a collaborative, maybe not completely our purview in public health, but very important to the overall health of our community, and going forward to figure out how we can collaborate with other groups and make it happen. So yeah, we're
Advocate.
absolutely.
Right. And you'll see in the notes, I mean, there's a number of leaders and representatives of other organizations that have volunteered and raised their hand and said, we want to collaborate as well. So, to be clear, a number of people said, what's neat is beyond the scope of any one health department, but really looking for your leadership to help how we can come together in a whole.
I have a question.
Mm-hmm.
I don't know if this is in the report, and if it's in the report, just let me know and I'll defer to the report. But how did you guys go about choosing the 88 people that you spoke to?
Worked with Carrie and the team, the health department team, and they did an initial roster by stakeholder groups. So we took stakeholder groups of healthcare, agency, faith-based, number of groups, and then they had a list of individuals in there, and we used that list.
They submitted a list to you of the people.
Yes, yeah, at the beginning. And then also, in interviews, we asked for recommendations for people, particularly on if they had a topic that they were making recommendations, and we'd ask, who did they have recommendations on who else we should be talking to. So there were some we added from suggestions from the interview on a specific topic area. And they are all listed, and then there's a summary of each of those interviews.
Thank you.
Very good. We appreciate all of your hard work.
Really,
We've been anticipating this.
my pleasure. Some of you know I had worked a couple years ago here in Porter County doing the suicide awareness and prevention study, and so Porter County has a special place in my heart, so I was happy to join you in this effort, so thank you.
Thank you so much. All right. Should we move forward to this septic variance? Okay.
So this is a septic variance that has been brought in front of the board. I'm just going to kind of do an overview of issue. You like to come up and person here, Jeremy?
I don't know if I made the agenda or not.
Yeah, you are.
Yeah, you are.
No, you're not. It was,
Oh, yeah, I wasn't.
yeah, if you want to, I guess if you want to have a seat up there, is those microphones. I'll just kind of give an overview, and then you can say, you can
Okay.
piece and everything. And we'll
Okay.
Okay. So, the situation that happened here is Mr. Garland. He was doing a remodel on a house and an addition. So it was an existing structure, and he was doing an addition, and the septic system needed to be upgraded and replaced. So he came to us. He went through the proper channels, got the soil borings. He had a design done. He himself put the system in. He got certified with IOPA and registered with us as an installer to put in his own septic system. So all that was, so the situation that happened here is we actually inspected most of the system, and it hasn't been approved yet because we still have some additional inspections to do because we haven't been able to check the pumps, the alarms on the mound system because there's not electricity at the property yet. So last time we were out at the property, Jacoby Mack, who is no longer with the health department, but he was one of the environmental health inspectors, was out there like November 20th of 2020. So that was the last time we have set foot on this property. And so what has happened is during his remodel, well, I should say, with this design for this septic system, because it was a replacement septic system and considered an existing structure, the state code gives the local health department best judgment. So, and in that best judgment, the state has come up with guidelines for pump-assisted perimeter drains. So perimeter drain goes around your septic field on 4 sides, and then normally it gravity feeds out to daylight. So, but in instances where you can't get gravity fed drain, on replacement systems, like for repair, it allows us to do pump assisted drains, and there's state guidelines on that. So that was all installed. We've inspected up to a point. Jacoby had inspected that. And since we had been out there last, the building department had been doing inspections on the residents. And in my talks with the building department, they basically came out there and said, well, your foundation for the existing structure doesn't pass code, and you need to fix this. So the choice that was made was he demoed the existing structure, now making the house new construction, and our permit was issued for a remodel with an addition, not for a new construction house. This was not brought to our attention. So in the building department, he now needs to apply for a new construction building permit instead of a remodel permit. And in order to do that, he needs a sign off from us at the health department in order to get his new construction building permit. But because things have changed, that according to the state code, that because the house is different, the footprint is different, some things have changed, that voids the permit under which the septic was permitted. And
I'm sorry, which things were that again?
what's that?
Sorry, can you repeat?
Because,
Things that have changed.
well, because the house is different. It's not the same structure that was on the design that we approved. And
But it is in the same footprint.
I understand it, but it's
Okay.
not the same structure. It's different. It's a different layout and all that. And you've also said that you've changed the driveway and everything.
I've
driveway.
I've applied for permits.
Right, but you're
Still pending.
going to change the driveway. So it's going to be different than the drawing
Yes.
that we approved.
Yes,
Okay.
pending a driveway, but
Right.
the footprint of the additions, that is where the house is.
Right, but it's not the exact same house that you're rebuilding.
No.
Okay.
Same amount of bedrooms.
No, I understand that, and
Okay.
that's fine. I'm just giving them a history
Yes. Yes.
what's going on.
Sorry, yeah, but yes.
No, you're okay. So the guidelines for the state does not allow pump-assisted drains on new construction houses. So this is kind of an odd situation because we've never had this before, where we've issued a permit for a replacement system, and in the interim, it has become a new construction house. So the reason this is coming in front of the board is we're looking for your approval to allow him to have this pump-assisted drain on this new constructed house, though we don't normally allow that. Like, if he had torn down the house and then come to us, we would not have given him, we wouldn't have allowed him to do a pump-assisted drain. But there's been extenuating circumstances with this because he didn't know initially the foundation was bad. That didn't come out till later. And so that's why I'm bringing this in front of the board, because it's not really my call to make, because if I'm following the normal way we do things, we would not allow him to have the pump-assisted drain. So he's looking for a variance to allow him to have this pump-assisted drain because of the extenuating circumstances of having to tear down the house mid-project. So the system has been installed according to the way we have approved it. It has been inspected up to a point by us. We just have to finalize the inspection. So, I mean, the system will work the way it's installed, but because in the past we haven't allowed these pump-assisted drains with a new constructed house, that is the reason for this, for coming in front of the board, because it's basically voided his permit because of the new construction and everything like that, plus this pump-assisted drain.
What are the downsides of a pump-assisted drain on a property?
So it's more maintenance. You have to make sure that pump gets replaced. And the thing is depending on where this is at and everything, that pump is going to constantly, every time that catch basin fills up, and I just want to make this clear, there's no effluent or sewage in this pump-assisted drain. This is just groundwater to lower the water table or where the septic system sits, so it can filter through dry, soil and filter out the contaminants and stuff. So it's more maintenance because, it kind of depends on the area, but whenever we get a heavy rain, whenever we get the smell, that there's going to be water there, and it's going to fill up that basin to a point, and when that pump kicks on, it's going to go and shoot it out to the road. There's a discharge pipe, and it's going to go out towards the road. So the big thing with him is he's going to have to maintain that pump, which one of the requirements we have them put on pump-assisted drains is they have to install an alarm in there, which then gets installed inside the house, and if that pump burns out, and the float goes up, but it doesn't kick on, there's a secondary float in there that kicks on, sounds the alarm in the house, and he knows he needs to replace that pump. So we do put precautions in place, and that's per the guidelines from the state for pump-assisted drains. And it's the same way that a pump works with like a mound system. If you have a sewage pump going into a mound system or a flood dose system, there's a pump with an on-off float, and then there's an alarm. So he'll have two alarms. One for the mound and the pump for the mound, and then one for this catch basin, which is the pump-assisted drain.
So, Dan, if I'm understanding correctly, there is, and maybe you can answer this for us, that there is no easy gravity,
Yeah.
lay of this land does not, and the drainage does not allow for a
It's
gravity.
not conducive to a gravity feed drain. It's very flat, because if he could have done a gravity feed drain, that's what he would have done. I mean, there may be somewhere where he could outlet a gravity feed drain, but in order to obtain that, he's probably going to have to go through other people's properties, get easements from them. If they don't grant the easement, then he can't go through their property. And it could be 600 feet away, as far as we know. There would have to be more study done, but there would basically you have to go to a surveyor and have them look at the topography for the county and determine where the closest drain out would be. drain outlet would be.
And the drainage of the soil on the lot, what's the soil like on the lot? Do we know that?
Yeah, I had that in the report I sent over, but I do have the soils here.
And this is a mound system, right? So it's a little bit
Of-
higher anyway than,
Yes. The
in
drain
ground
depth
system.
requirement was 34 inches. So generally, they have to go 2 inches into glacial till, which is a hard pan layer. It's water takes a long time to pass through it. And so that's pretty shallow for a drain in my experience. So the fact that he can't get an outlet for a 34-inch drain, I mean, that property is pretty flat out in that area. So he didn't do the pump assisted drain by choice. It was kind of more of a necessity because of the contour of the property, the slope and everything. There's just not a better option nearby. If there was a better option, we would have had him take that option.
and some things the board would want to keep in mind is that this is not the septic field itself.
Correct.
It handles the storm water and runoff
It would be
around
water and
field
surface water that it's
and really protects the septic field from failure and being flooded over with storm water.
And if he doesn't maintain that drain, he's only hurting himself because then he's not taking that groundwater away. It could become saturated in the area, which could cause a septic issue, and we're going to respond to and make him correct. So, yeah, I mean, and according to Jacoby's notes, everything has been approved up to this point. The installation of the system, the installation of the tanks, the installation of the drainage, really are only, before he gets his approval tag from us, we have to check the floats, make sure they're turning on and off, check the alarm, make sure it sounds, that kind of stuff. So it's just probably one more inspection.
That requires electrical to be.
Yes, and in order to get the electrical, he needs his new
Permit.
construction building permit.
God.
And in order to get his new construction building permit, he needs to sign off on us. So,
This has been going on for how long?
It's, well,
Too long.
labor shortages, it's tough out there. I don't know what to say, but no.
For 3 years?
Yes, I think Ann nailed it on the head.
I got
Like-
everything correct.
Just maybe add this, if I were to try to build this system in the middle of a cornfield, Dan would never have signed off on this because there was no existing home. Well, my home was existing and we decided to, all that. But,
Right.
so that's the huge difference.
Yeah, if this was a vacant lot, unless he could find drainage off-site, it wouldn't be suitable for septic. But because there was an existing structure there initially, it's considered a replacement system, which the state code gives us best judgment on. So that's why we were able to allow the pump. But then, because of extenuating circumstances, he had to build a new construction house. Issues with the
Due to extenuating
so
circumstances.
the foundation.
Doesn't change the initial way this would drain per se.
No, it shouldn't. It's still gonna flow to this catch basin. It's still gonna get discharged.
More semantics.
Right. It's more of a, normally if he had come to us and said, I want to build a new construction house, we wouldn't have allowed the pump assisted drain. So we're just trying to get approval from the board. He's looking for approval from the board to retain this pump assisted drain, even though he had to build a new structure a new house on the property.
And from the mechanical and expert side of this, you would support it.
Yeah,
just a matter of-
reviewed the plan, and
You
the
have-
dosing calculations for that pump assisted drain and everything. So everything has been approved by us on the design. So, and from our inspections, it has been installed according to the design.
Can we entertain a motion to approve this variance of the pump-assisted drain unless there's any concern or?
A second.
Motion.
Okay. Dr. Bossom?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Kathy?
Yes.
Dr. Osana?
Yes. May the force be with you.
Godspeed. I hope you get to move into your home.
They're always papers, yes.
Very crazy.
Good luck. Good luck.
Poor guy.
I know.
Cats,
Nightmare.
Wow.
Okay, on to our next new bit. Our attorney, Dave Hollenbeck, his contract is up for renewal. It was sent to all of us for review. I'd like to say I'm thankful that you are willing
Yes.
to stay with us for another year's contract. So unless there's any question or concerns regarding Mr. Hollenbeck's contract, I would like to, if anyone could entertain a motion to approve his contract renewal effective today.
Approve.
Thank you. A second?
Great appreciation.
Second.
Thank you.
Okay. Dr. Bosson?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Kathy?
Yes.
Dr. Rosan?
Yes.
Thank you.
You
Well,
don't get
thank
to
you.
leave us.
Yeah.
I thank you. I hate to admit this, but a couple of years ago, when I looked across the members of the Board of Health, there have been some changes. I had been the health department lawyer longer than two of those people had been on earth.
Not me.
So, thank you. We have an incredible staff. These are going to be incredible times at the health department, and I'm really excited about the opportunity that you've given me to continue to have that opportunity. Thank you.
Thank you.
Need your help.
I'm happy to sign this.
Yeah.
Yeah. Okay, old business. Any old business? No? Your report, sir?
I have no report.
Wow. Okay. And we've had the claims and receipt make its way around. Everyone has had a chance to sign it to get it back?
No.
No? Okay.
No.
It's stuck over here. Glad I asked. So then when that's complete, we can hand it over to Chris. Okay, reports of committees, staff, health officer. I did your, there you go.
Throw it at me.
Well, sorry.
Have we approved the claims and receipts? I'm sorry.
That's the last signature. Do we need to do a vote, entertain a vote
Thank
to approve the claims and receipts? Can we have a,
I will make a motion.
thank you.
Blame
Dr. Brunswick.
Dr. Bosson?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Kathy?
Yes.
Dr. Rosan?
Yes.
Thank you.
Okay. Thank you, Chris, for keeping us on line. Reports of committee, staff, and health officer, in your order of choosing.
I do not know what this is. I am bound and determined to knock it down. I'm so sorry.
You may.
All right, so I just wanted, I'll bring my chair closer. I just kept knocking.
It's like a.
I just wanted to reiterate that we will be sending out that public health needs assessment to everyone tomorrow. And so as Jan had mentioned, we can review it and contact her with any questions that we might have in the month of December. And then, Dr. Boxman, did we decide after the holiday we were going to in January?
Yeah, I thought we could mull over all of these, give ourselves the opportunity to review it, collect our thoughts, and then come into the new year and deep dive into our plans going forward and to addressing these issues.
Wonderful.
If everyone's agreeable with that.
So then on December 12th, we will be at the commissioners meeting to give our commissioners update, which we're going to do once every 6 weeks. And we'll kind of give them the highlights of the needs assessment, staffing updates with positions from First Indiana. So with that, I wanted to introduce, we have a few new staff members with us here today. So Carrie Honeycutt is with us. If you could just stand up, Carrie. So Carrie is our new care coordinator that we've been talking so much about. We approved the position and the pay rate, and we posted the position for the 30 days. We received 60 applications. We interviewed 10 people. Yeah.
Wow.
And Carrie started yesterday, and she has been busy. So mostly yesterday and today, gathering resources from all of the information that we've gathered, information that she has from her contacts out in the field. She met with Sam Burgett today as well. They're working hard on Find Help IN and the implementation for that. They've kind of got a game plan together, and they're having a meeting with the developer next week. And then tomorrow, there are several other things that I made notes about that we're going to dive into. So we're just hitting the ground running. So it's been very fast paced. So we just appreciate you being here. So thank you. Thank you. And then we have posted the contracts and grants specialist as well. So that posting went up on November the 20th. And we do currently have one applicant. So after the 30 days, then we will have interviews for that. And depending, they can start as of January the 2nd. So we're looking forward to that piece. And we do have a form that's been in the works from the state as far as keeping track of all the metrics from the KPIs as they currently stand. And so in addition to the public health needs assessment going up, of course, our plan as we all implement it together and begin to work on that will also be up on that Health First Indiana link on the website, as well as that tracking document, updated monthly. I don't see why not. And as was, cited in the needs assessment as far as kind of seeing where we're at with all of those things, so everybody can see where we're at with those metrics. So I also wanted to introduce, I know that John had come and discussed his contract, and we talked about a deputy emergency preparedness coordinator. And so Jeff started with us yesterday as well.
Oh.
So he's working with John now, and he will be here on the days that John is not, and when John is out of town flying or for drill and things like that. So
Exciting. Thank you.
Jeff as well.
Thank you.
I think, and then everybody saw. Retirement. Okay. We had sent out the email about Connie's retirement as our director of nursing, and we have the invitations in front of you. And then we also have one of our employees is also retiring on December the 29th, Tony Moore. And so he has worked in, the city of East Chicago and Gary, and also for the state. And then he came to us. He's been here for just over 5 years in September of 2018. And he will be staying on with us part-time because he is our lead risk assessor and inspector. So he will continue to work for us part-time. And then the entire environmental team is going to get trained. But for right now, he will be continuing to do that on the hourly basis, and then he will work to do the hands-on portion of their training as well. So we really appreciate him, and just wanted to bring that to everybody's attention as well.
Thank you, Connie. I mean, 38 years, amazing force at the health department. We appreciate you, and I wish you peace and relaxation and time with your family. You've certainly earned it. You've certainly earned it.
Okay.
Okay.
Yeah, I just have to say that I'm excited to start looking at our kind of dream sheet of programs and looking at our needs assessment and prioritizing 1, 2, 3, 4, kind of getting everything all kind of all lined up and talking to people and figuring out where we can help best. And yeah, I think the next few months are going to be exciting. Yeah, really exciting. Connie, I have so much appreciation for you, and 38 years. I don't know. It makes me feel old that you're leaving. Is that I think there are only 2 or 3 other people in the health department who've been there longer than I have now. So I felt like you were like the the grounding force, right? The stability, and everyone was newer, and now I'm an old timer too. But you know, Connie, as nursing director, she established this great team of registered nurses who are team players, and they're smart and enthusiastic and really dedicated to the public health in Porter County. She's really developed a great staff. She's advocated for that staff in training and other opportunities, and instituted programs, and worked with other leaders in the areas of government, and served on boards of community organizations, and just it's been a really great over a decade of being able to collaborate with you and work with you, and I really appreciate everything you've done for the health department. We will miss you. Yes. And that's all I have.
Okay. Miscellaneous additions? No? Okay. Then at this time, I can open the floor to public comment. Oh, thank you. You get 3 minutes, Councilman.
Don't start until I. Good luck.
I know. I'm not in charge of the clock. I enforce it.
Ready,
Okay, ready?
Yes.
Go.
Go.
I had a privilege of working with her at the with the suicide prevention. So again, awesome information, and I know we're gonna do well with it. Also, with that, I'm looking forward to the council working with you guys on behalf of some of those initiatives too, because what we can do to help this community get better, I think we're all for that. But that's actually not why I'm up here. Connie, first of all, I want to. 6 years ago when I came in office, you were one of the first people I met. Talking about a fireball, pistol. Kind of like, holy crap, what did I get myself into, right? And but one of the greatest sense of humors, and I've always appreciated going down to the health department, and especially knowing I'd see you, because there'd always be some fun banter going back and forth, and that's going to be missed on my part. There's no doubt about it. And unfortunately, I'll be up with my goats on Friday, so I will miss. That's why I won't be at the going away. So, yeah, Stella, I'll say hi to Stella from, yeah. But I want to read this here. This is a certificate of appreciation from the council. It says, in recognition of your 38 years of compassionate care, support, and tireless advocacy for the health and wellness and being of the citizens of Porter County, we present this to you. So if you want to up to a microphone, you know.
I told him I said, goats take precedence over,
Yes.
you know, and at my house, we raise beef cattle, so I know the beef cattle take precedence over me there too. You know, I think back, actually today, in 2001, December 5th, 2001, I was named director of nursing, so it's, there's a lot of memories, a lot. And I just have had some really good mentors, good people to work with that I've learned so much from. And, you know, even through hard times that, you know, you can laugh. And, but you get through with those people that you have around you. And with all of you here, and Dr. Stamp and Carrie and Chris and all of my coworkers that I really enjoy. There had to be something bringing me into work every day and keeping going, because this COVID was not easy for any of us, but we kept on going. But it's been a pleasure, and I have enjoyed every minute. And thank you.
Thank you.
And we did get under 3 minutes.
Yes, you did.
Impressive.
Well
That's
played.
quite the accomplishment.
Now
Any comments? Any further comments? Yeah.
All right. I don't know if I can top that, but I'll give it a shot. My name is Jake. I'm the president of the Portage Recovery Association. We've been around almost 31 years now in Portage, and we had the pleasure of having Dr. I can say your names now. Dr. Buxton, Dr. Stamp, and administrators. You know your name, Carrie.
Yeah.
Good
job.
Yes, that's
While I was sitting there and I couldn't do it. Yeah, we have 12-step meetings and sober events for the community of Portage. Been around almost 31 years. We just recently opened Next Chapter Cafe, which is a recovery cafe of our own in Portage. I heard you mention 320 earlier. I had a meeting with them the other day. They're super cool. And we're going to kind of borrow some of their ideas. They're going to use some of our stuff too, so we have a great working relationship. But we, with this cafe, it's kind of like a sober bar, is what my vision is for it. And you can come there and watch the games, play pool, play darts. We just ordered some board games. We got an Xbox coming in, which is like really cool too. And right now we're open 5 to 8, Monday through Saturday. And if the Bears play on Sunday, I open it up. If they don't, I don't open it up. But I just kind of wanted to come see some more faces from the council and just like publicly thank you guys, because like you guys reached out to us, which I think is like the coolest thing, because for me it shows, because I'm also a member of the recovering community, almost 11 years sober. And it, like for me, it like just shows like from where I was to like where I'm at, and like people are reaching out to us, like our organization, and like people look at me for answers and leadership there, and like so it feels really good to hear like professionals and stuff contact us, because like, you know, the only professionals that were contacting me like 10 years ago were like lawyers and you know, child support people, crazy stuff. So it's like it's cool to hear like on the other side, like we do recover as a whole, man. And our organization, I heard 320. There's so much focus on like health and faith, but our organization is more focused on unity. And I feel like no addict can recover alone. And we have a goal of hopefully in the next 2 years, I'm hoping the next 2 years to have a 24-hour place where any person seeking recovery at any time can show up, walk in, have some coffee, hopefully have some people with some certifications and cool titles under their name to have someone to talk to. That way no one's ever turned away. And the last thing I'll say is that like Thanksgiving, for instance, we had our cafe open. We had over 20 people that showed up. And that was like on a whim of a notice, and some people like they just had nowhere to go. Like literally, like we ruin our lives, we ruin the people around us, we ruin marriages. Not me, but a lot of people like myself, we burn a lot of bridges. So the place that we're working on right now, like I said, with the future vision of being 24 hours, is to make sure like every addict has that opportunity, like a day at a time to recover. So just wanted to say what's up.
I just have to say, for myself, I was extremely impressed with your establishment and the leadership that you provided with your partner. Can you repeat the stat that you gave us? I don't know if you remember off the top of your head, of how many places people can go to drink, but yet how many places can people go to not drink and have support?
In the city of Portage, there's 62 different places to purchase alcohol. 62. There's currently 3 different places where you can go to kind of like a 12-step meeting or recovery-based event. And 2 of those places only do once a week. So we're open all the time. Like I said, our cafe is 5 days, Saturday, Bears games on Sunday. But our actual facility, which is in the same building, we just got the cafes on one side and our meeting room is on the other side of the building, and there's like a real estate and a cleaning place in between. But we have meetings every day at 9 o'clock, sometimes at 5:30, and then every night at 8 o'clock. So we're open all the time, 30 meetings a week. Several different 12-step fellowships. We're going to put in like recovery yoga, art, have an outdoor volleyball court with lights. That's like my dream. And so, yeah, and the best is yet to come, I'm sure of it. Like I got a lot of stuff up here, like, and it's just cool to share it.
Thank you. Thank you for the services you provide.
Thank you. Thank you.
I was afraid he was going to go. All right. Anyone else? And we have a motion to adjourn. Okay. Okay. Thank you very much. And we will see you all back again on January 9th in a new year. We'll see you next year. Yeah. Thank you.
Happy holidays.